56-year-old South Carolinian Stephen Knight Jr. woke up before dawn New Year's Day with a searing pain on his right side. He went to the emergency room, thinking he had a kidney stone, but physicians discovered something much more ominous, a cancerous tumor on his right kidney.
It was a shock, but I still figured it. I had a lot of confidence in my doctor that there'd be something to be done about it.
Stephen was diagnosed with renal cell carcinoma, the official name for kidney cancer, and immediately had a nephrectomy, the surgical removal of part or all of the kidney.
It took several months to return to what you would call normal as far as lifting and working and your activities. But surgery was a lot less than I ever imagined it to be.
But within a year, doctors discovered the cancer had spread to his lymph nodes. They told Stephen he probably had less than 6 months left to live.
Good girl. It put me in a little bit of a panic, in a big rush of panic, a little bit of fear thrown in there, real concern about who's going to fulfill my responsibility that I had with my family.
Stephen worried about who would care for his aging parents, and he fell into despair.
I had no hope whatsoever left. I had already pretty much figured that 6 months was about it, give or take a little.
Stephen was told his best chance for a better outcome may lie in a clinical trial, testing an immunotherapy, a medication that works with the patient's immune system.
When we learned that things like chemotherapy weren't very useful in the treatment of advanced kidney cancer, the concept arose that perhaps we could use the body's own immune system as a way to treat the cancer, sort of mobilize the body's immune response, if you will, to treat the cancer. And that's proven to be the treatments that really have emerged as potentially useful.
But there is one significant drawback associated with immunotherapy medications.
These are difficult medicines for patients to take for prolonged periods. They're not pleasant. They have a lot of side effects for these folks.
But despite the side effects, these immunotherapies appear to work well in some patients.
And it's been found that about 40% of patients will have some shrinkage of their tumors, and this can last for well over a year.
It's a first step. I mean, certainly we're not seeing cures with this, unfortunately, but at the same point, now we're beginning to see patients whose disease is slowed down. They're clearly not having their cancer progress as rapidly as it did before.
There's no cancer visible in my body anymore. So I got to see my daughter get married, and I didn't expect to see that. So I've had a pretty good year.
Experts say soon, therapies that can specifically target the biological foundations of kidney cancer may be available. And there are other innovative treatments on the horizon that offer kidney cancer patients real hope for the future.